Welcome back to In Focus, and it's time now for our twice-weekly In Focus health update.
And reporter Linord Moudou joins us now with a look at the dangers of malnutrition among children. Hello, Linord.
Hello, Vincent.
Hey, Linord.
Hello, Dimiake. I'll have that story shortly, but we begin in Brazil, where the legendary Carnival celebrations are ending today, and health officials distributed nearly 3 million free condoms to Carnival participants. Rio de Janeiro state officials say the initiative aims to stop the spread of AIDS and other sexually transmitted diseases during the event. Officials say this year's campaign targeted gay men between the ages of 19 and 24. In addition to condoms, officials handed out thousands of pamphlets to crowds at samba dance performances and block parties during the annual celebration. Other major Brazilian cities had similar programs. Tents were also set up to perform rapid testing for HIV and hepatitis. Save the Children has published a new report highlighting the scope and the dangers of children's malnutrition. It reveals that 1 in 4 of the world's children have stunted growth, and their body and brain have failed to develop properly due to malnutrition. The report says 500 million children could be physically and mentally stunted over the next 15 years, with malnutrition contributing to the death of over 2.5 million children each year. In Mauritania, the government has launched an emergency national plan. UNICEF is working with partners on the problem. Lucia Elmai is the Mauritania representative for UNICEF.
The level of vulnerability in Mauritania is already very high, with high level of poverty and vulnerability for children. So we need to act now to prevent a larger number of children to become moderate and severe acute malnourished, and to somehow rebuild the resilience of those communities to face the very early season that is starting now.
Mauritania officials say one of the main challenges is getting to children in remote and isolated areas. Dr. Ahmed Ould Aida is a food program coordinator for the UN Millennium Development Goals Fund.
L'accès aux populations est très difficile.
It is truly a difficult population to reach because they are completely isolated. The coverage of health is poor, as it is a region that is challenging to access for several reasons, such as security and geography. This makes it hard to deliver to them the needed services to respond to their circumstances.
Severe drought also devastated the Sahel region in 2010. Experts say climate change has a role in recent famines, and efforts are underway to build community resilience through investment in agriculture and health and nutrition services.